All right. Hi, everyone. My name is Meghan Mullaly, and today I'm going to be speaking about the health impacts of environmental noise exposure in the context of my practicum experience at Toronto Public Health this past winter. I'd like to start my presentation with a brief thank you to many people who supported me through this journey. Just some of them are listed on this slide, so thank you so much for your substantial support this past term. Project background. The City of Toronto began a review of their noise bylaw in 2015 under the Municipal Licensing and Standards City Division. Early amendments to their noise bylaw that were presented in 2016 caused significant concern from stakeholder groups as target noise guidelines were considered too high at the time. Toronto Public Health was asked to provide input on the health impacts of noise exposure, and individuals from Ryerson University were asked to look at actual noise levels in Toronto. My contribution was a literature review on the health impacts of environmental noise to help inform evidence-informed decision-making by Toronto Public Health and the City of Toronto. The purpose of my literature review was to assess the evidence for the health impacts of environmental noise exposure that have been published and reviewed since the most recent review by the World Health Organization, and to determine what impact, if any, the most current evidence would have for environmental noise guidelines in the City of Toronto. I completed a structured literature review to assess all of the evidence available via the database search within PubMed. I appraised the studies for the quality of their evidence and then provided a synthesis to address the question of whether the World Health Organization and Ontario noise guidelines are health protective across a series of health impacts. The sources of environmental noise prioritized for this review were based on their prevalence in Toronto, and the health impacts of review identified were based on topics previously reviewed by both the World Health Organization in 2009 and 2011, as well as Toronto Public Health in 2000. We specifically focused on non-auditory health impacts with examples such as cardiovascular, pulmonary, and mental impacts. Okay, environmental noise. Environmental noise is defined as originating from a variety of urban sources, creating undesirable and potentially harmful conditions for individual health. This definition excludes occupational noise exposure, as this category is covered by a separate and provincial regulation related to worker safety. Researchers use a variety of key measure types to assess sound levels, the most common of which are on this slide. With L max as the exception, all of the other common measures are averages of sound level. And these measures vary in the time periods in which noise is measured and averaged. As you can see on this slide, both the WHO as well as the Province of Ontario, the Ministry of Environment and Climate Change, look at daytime and nighttime noise levels. It is thought that if noise does not exceed these target sound levels, adverse health impacts will be prevented. And this was the basis for my comparison of my findings. As you can see, both the WHO and the Province of Ontario have the same standard target noise guideline for daytime noise at 55 decibels, and they differ in their nighttime noise guideline at 40 and 50 decibels respectively. The key question then for comparison is, do the WHO and Ontario target noise guidelines restrict noise enough to prevent adverse outcomes based on the findings of my review? The current target noise guidelines of both organizations do restrict noise enough to prevent health, to protect health as they relate to increased relative risk of mortality from ischemic heart disease in individuals less than 65 years of age, mortality from diabetes in individuals age 65 and older, mortality from coronary heart disease, as well as depression. The current target noise guidelines do not restrict noise enough to protect health as they relate to increased relative risk of myocardial infarction, cerebrovascular disease, and adverse behavior outcomes among children. And finally, the current target noise guidelines do not restrict noise enough to protect health as they relate to increased odds of annoyance experienced among adults and hypertensive heart disease. Seniors experience increased risk associated with chronic environmental noise exposure across health impacts, many of which are seen on this slide as the results of my literature review findings. Children are another population with limited autonomy in both their residence as well as their daily routine. They also experience more time outside during the day, during noisy daytime hours, more time than adults, and therefore their rates of exposure are generally higher, and they are more at risk. As my focus was on environmental noise in the City of Toronto, I looked at many of the documents describing the context for the city as it relates to environmental noise. In this discussion, I found that the extent of government regulation of environmental noise really varies across jurisdictions and is often much more representative of societal and culturally specific preferences as opposed to strict scientific thresholds that I showed in some of my previous slides. And as you can see from one of Toronto's documents outlining their vision for the downtown core in particular in the future, they're really looking at a 24-hour context with, just as an example, a rich live music scene. So all of this will play into the policy discussion around environmental noise going forward. Most studies that I looked at examined single noise sources. However, I feel that policy debate on this topic of sound limits in urban settings should account for a more synergistic effect of multiple noise stressors that individuals experience in any given day or night. In conclusion, the target noise guidelines recommending 55 decibels of sound during the day and 40 to 50 decibels at night have been referenced for many years. They are, however, increasingly exceeded in urban settings like Toronto. The Toronto, I feel, should continue to work to reduce environmental noise levels, even if current conditions already represent risks to health. As well, noise regulation in Toronto should account for the multitude of intersecting determinants of health that currently, as we have seen in the case of both seniors and children, influence an elevated and inequitable risk to health among specific populations exposed to environmental noise within the city. So, thank you.
That was a very interesting talk, and actually you've succeeded in making me feel quite guilty because I'm a motorcycle rider and I love the sound of my exhaust.
Yes. The road noise category has a significant impact on health. That is true.
Actually, the other thing that's sort of interesting is it's quite, I think, in some ways subjective, because I remember a few years ago, some of you might remember this, there was a colony of sea lions that spent some time on one of the islands off just near Oak Bay, and all the residents were complaining about this racket made by these sea lions. But you know, I loved them. But anyway, there's some questions.
Hi, I want to say, as a Torontonian, thank you for shining some light on this. I was just wondering what, in your research, were some common sources of noises that would kind of cause these health impacts?
Mm-hmm.
Or sea lions.
Or sea lions, not many sea lions. I found that the most common sources of noise looked at in the most current research really related to noise from aircraft, so a lot of research around people living in proximity to airports, as well as rail lines, and then most commonly related to noise. In addition, it was seen that people seem to have the most adverse outcomes with proximity to roadways, major roadways. So those were sort of the main focus. It was a limitation of the paper. There was certainly interest to look at other noise sources, but there was just not necessarily research being initiated in those areas.
Thanks.
Thanks for a great presentation. I'm sorry if I missed this in your health equity section, because I found the effects on seniors and older adults very interesting. But I was wondering if you saw any disproportionate effects along the lines of class or race in terms of how communities are organized?
Yeah, it's a really good question. Another interesting piece of work that was happening in parallel to my literature review was an actual noise monitoring study happening in Toronto from researchers at Ryerson University. And so they were really able to take that raw data from many areas in Toronto, look at the demographics of census tracts and as they relate to noise levels. Unfortunately for today's purposes, because that report has not yet been made public and will be presented actually at the same time as some of my findings in June at City Council. I can't share details, but I have seen in other jurisdictions that particularly average socioeconomic status in census tracts is related to higher noise levels.
There's one more question.
A great presentation. I was just wondering, now we're living in environments that are very close in proximity, like condos, apartment buildings. Did you uncover anything about noise in these areas?
Yeah, so one keen area of interest for many people, especially those living and working downtown in Toronto, was that environment where we do spend quite a lot of our time, either in office buildings, for example, or in your own home. The noise experienced between apartment units, for example, was not within the scope of this project. So we weren't looking at noise experienced indoors as much. However, some of the findings did look at, as I mentioned with children, there was an impact of the amount of time they were spending outdoors as opposed to adults in a more insulated experience inside. So there are some noise mitigating experiences when you do spend more time indoors, but it wasn't necessarily the focus of this review.
Hi, Megan. This was an excellent piece of work. I'm trying to figure out how to make this a question. Would you tell the group what you're going to do with your piece of work next?
Great. So as I alluded to, this literature review was part of a larger project of environmental noise at Toronto Public Health. So these findings will be informing Toronto Public Health's recommendations to City Council in partnership with municipal licensing and standards around the future of the noise bylaw in Toronto. So my hope is that some of these findings and how they relate to health outcomes is taken into account in that noise bylaw. And I've had a lot of really exciting discussions with Kathy and others at Toronto Public Health about publishing the literature review component. So that's the next step.
That's great. Great to hear that. Well, thank you again.
Great,
for a
thank
very
you.
interesting talk.